Years ago, Roskamp Institute Executive Director Dr. Michael Mullen and other researchers were interested in how a drug called nilvatipine could affect Alzheimer's.
We first started looking at this drug because it's an antihypertensive and it has the ability to open up blood vessels in the brain.
They first looked to see if it would have that effect on mice with Alzheimer's.
And it did do that. It increased blood flow to the brain, but what was really surprising was it got rid of the amyloid that was accumulating in the brain.
A toxic protein.
At the center of the storm, as far as Alzheimer's is concerned.
So they didn't stop at mice.
Finally ended up in a phase 3 clinical trial in Europe with 500 Alzheimer patients.
Half got a placebo and the other 250 got nilvatipine, which isn't FDA approved in the U.S. Patients were divided up by their stage of the disease.
When you look closely at the ones in the very early stage, they are separating out from the placebo.
Early stage patients who took nilvatipine had a much slower cognitive decline over time.
In fact, there's about a 50% reduction in the rate of decline.
It's important to clarify this doesn't mean there's a cure yet.
We don't have a complete victory, of course, because we're just looking at the very early stage cases.
And they're working on other forms of the drug
that don't have the blood pressure lowering effect, but still have the anti-Alzheimer effects.
Dr. Mullen says if you or a loved one wishes to be part of a clinical trial, time is of the essence.
If you're going to treat Alzheimer's disease, even experimentally, you have to get in very, very early, maybe even before symptoms begin.